All right, making a short video on the bones and bony landmarks for the shoulder girdle, which is week 10. And so I'm looking at activity number 1, palpate the following bones and landmarks. So we have the clavicle. Here's the medial end of the clavicle articulating with the manubrium. This would be your sternoclavicular joint. And then over to the lateral end of the clavicle articulating with the acromion. Right here would be your acromioclavicular joint. And we have the sternum, manubrium, body, xiphoid, nosy and xiphoid, the sternal notch. And then we have a number of landmarks pertaining to the scapula. Remember, the shoulder girdle is the clavicle, scapula on rib cage. So we have the coracoid process. The anterior surface of the scapula sits on the rib cage. We have the glenoid fossa. We'll study that next week. The head of the humerus articulates with the glenoid fossa. Just talked about the acromion process. Turning around. So from acromion, spine. Here's your superior angle, medial or vertebral border, inferior angle, axillary or lateral border of the scapula. Now, go back to the spine of the scapula, and above that there's a fossa or depression. This would be your supraspinous fossa. And then below, inferior to the spine of the scapula, would be the infraspinous fossa. Now, something that is not in your textbook, the very medial, I got my finger on it right now, the very medial aspect of the spine of the scapula is referred to as the root. And this is where the lower trapezius is going to attach. We have the rib cage. Obviously, we can look at the ribs from the front. We can look at the ribs from the back. And then we have the vertebral column. Note that the ribs articulate with the first 12 thoracic vertebrae. Now, I've taken the skull off. Okay. I'm going to turn around. This bone here is the occiput, and there's a little protuberance. You can find it all on yourself. This would be the occipital protuberance. And then we have the 7 cervical vertebrae. We have the 12 thoracic, 5 lumbar, and then something that I brought up in class. The scapula sits between ribs 2 and 7. Okay, 1, 2, 3, 4, 5, 6, 7. And then the inferior angle lines up with the spinous process of T7. The spine of the scapula lines up with the spinous process of T3. So when we palpate on each other, we're going to want to use those landmarks. And activity number 2, demonstrate the movements of the shoulder girdle with respect to plane and axis. We have elevation, depression. That would be along the frontal plane, elevation, depression. There is no axis because the entire scapula moves in elevation, depression. There is retraction, okay, so retraction, protraction. That's occurring along a transverse plane, protraction forward, retraction, posterior. Here's my transverse plane. Again, no axis because this is a linear movement. Now when the humerus moves in abduction or flexion, can't really show it on the model because the scapula is fixed, it upwardly rotates, so the inferior angle moves up and out. That's when we abduct our humerus or flex our humerus. When we bring our arm back to anatomical position, the scapula downwardly rotates. That is occurring along the frontal plane with an axis right through the top, that superior angle, upward and downward rotation. So you should be able to demonstrate these motions with respect to plane and axis. The one motion that occurs just from the mechanical compression, when the humerus hyperextends, it's going to push the scapula into tilt. So my hand is the scapula tilting. So the superior part of the scapula moves anteriorly, the inferior angle moves posteriorly. That is scapular tilt. There are no muscles that tilt the scapula. It simply occurs during hyperextension when the head of the humerus abuts the scapula and causes it to tilt. All right.